what would you say is the relationship that you have with industry at the moment? Do you think it's a healthy one? Do you think it's productive? From your point of view, how do you perceive that relationship?
Yeah, I mean, I do think that with the medical devices industry, we do
Yeah,
have
with devices. Yeah.
yeah, we do have a very good relationship. I think they have access to us. We've created structures that I think their working group meets every month, if not every other month, wherein there is industry representation and SAHPRA, and we deal with issues around guidelines, around our requirements, etc. And so far, the feedback that I've gotten is that those engagements are working well. Obviously,
Okay.
it's you have to assess it quite regularly as new things come up, as you start to regulate. So at least the comfort that I have is that there is a mechanism in place for industry to engage with the regulator, which was not always there.
Okay. I I'm inclined to push back slightly on that, but I recognize that it has gotten better, and this is from me, who relatively new in the industry. I recognize that it has gotten better from the years of MCC transitioning to SAHPRA, etc. There's better engagement, but my pushback would be that it's it's one thing to have engagement, but are we actually producing any practical outcomes from these engagements? Because we can engage for many years, but actually when we leave those meetings, the regulator goes that way, industry goes that way, and then that divergence keeps increasing. That's always my worry, that yes, we can engage, we can even have these conversations, you and I, but for me the key thing is always, does something come out of that? So that's why I'm saying I'm inclined to push back, because it seems, and I'm not just saying that about SAHPRA, I'm just saying in general, it's something that we tend to do quite a lot. We have these discussions and we raise awareness, but things really move quite slowly because it takes us maybe like 10 years to actually put in place the system we spoke about 10 years ago.
Yeah.
Do you agree with that?
So not
With
quite,
that
right?
claim? Yeah.
No, not
Hmm.
quite. I think there are elements of
Okay.
it that are correct. Let me talk about what
Okay.
I don't agree with. I do think
Sure.
if I consider the medical devices area, the benefit that
Yeah.
those engagements have had are around
Hmm.
really the pain points on guidelines, on what is it that the regulator expects, when
Okay.
are you going to do what, etc. I think what one of the challenges with all of these platforms that we have is
Uh-huh.
it's with industry associations. So if an entrepreneur, who has a company that they've just set up is not part of that association, they then will not have access to the regulator, right? Because it is
Yeah,
at an
fair enough.
association
Fair enough.
level. So I think that for me is where there's a gap. And we've seen in the medicines area wherein, people are very intentional about creating associations and then that association then having a voice. Because again, we're not going to engage with all 50 companies, right? It just is
Yeah.
not going to work. But with an
No,
association,
absolutely.
we can send through. So I think for me, it's these from an industry perspective, it's not a good representation of all the kinds of companies that we have
Fair
and
enough.
even the innovators. So I do think that there's a need and there's a gap there for a medical devices. I mean, if I think of some of the diagnostic companies in Cape Town, etc. I don't know if they're represented in these fora, right? Because it's big
I get you.
industries.
And
South,
I would even I would even go as far as saying that maybe some companies, some entrepreneurs don't want to join these organizations because they say, well, it's probably just going to be a dialogue that's going to result in more dialogue. I would rather try to sell in Europe or America and just follow that route. Do you think that's a possibility? That there's a lot of companies that actually they almost how can I say this? They almost are bypassing the potential engagement that they could have had with the regulator because they're seeing it. And I'm speaking maybe even from experience, anecdotal experience with some clients, etc. Right, where they feel like, well, we might as well just like, who needs SAHPRA? I mean, sure, we need the establishment license, we need to put those things in place, but they almost don't worry about the South African market because they just see it as moving really slowly. Do you agree with that, or have you seen that as well?
So I've seen that, right? But it's actually it's not just
Mm.
about the regulatory issues. I think medical devices, we always say the barriers there are less than the barriers with medicines, but the barriers are
Yeah,
there, right?
yeah,
But what we've seen is, again, the other issue is the South African market is small. So the question becomes, why
mm.
must I put in all this effort to get a
Yeah,
SAHPRA
yeah,
registration, and yet I actually, my big market and my big revenue is going to come outside of the
yeah,
country, right? And so I think it's almost a combination of both. And the thing about the point wherein I wanted to say I agree with you is that, and being now on the other side, I realize the complexity of this, particularly with all these legal challenges that we face, right? That, by the time that a regulator puts out a position, a guideline, a framework, etc., you need to consider all ends, right? So if you think of the regulations now, some of the feedback we've received from industry has led us to a point where we need to engage with legal to say, actually, we see
hmm
where industry is
right,
going here. What are the legal ramifications of that, right?
right.
So it may seem like we're
Yeah,
dragging our feet, but in the back end,
I get
there's
you. I
something
get you.
that, so there's many considerations. And I'll give you an example. I mean, with the COVID vaccines, you may have seen that, some organizations have taken us to court for
Yeah,
authorizing vaccines for
yeah,
12 to 17-year-olds. And they literally want to see everything that we've done, every single piece of documentation, right? Which says, as a regulator, you must make sure that you've got proper processes and systems and legal frameworks for you to be able to come out with a decision. So I think, and my view with the team was that let's invest the time, particularly with medical devices, getting things right with these regulations so that when we start implementing, we don't have a lot of comebacks. There are a number of our regulations that other associations are challenging. They've taken us to court. The complementary medicines regulation. We currently have a court case on that, right? So
yeah,
you really want to make sure that you learn from that and you do things differently. It takes long, but it means
yeah,
that then when we start implementing, there's then alignment.
yeah.
Thank you for joining us for this engaging conversation. To find out more about Infomed, visit infomed-consult.org. See you next time.